My dear friends, if lately every time you stand up from a chair, your knee feels as though something inside is squeezing tight, or when you step out of bed in the morning your legs feel stiff, heavy, and slower than they used to be, then I want you to pause for a moment and hear this. Knee pain after 60 is not normal. It is not just aging, and it is absolutely not something you are destined to live with for the rest of your life. According to a new 2024 study, more than 70% of knee pain cases in adults over 60 are actually early signs of something deeper. The muscles around the knee, the quadriceps, hips, and glutes have been quietly weakening for years without the person realizing it. When these muscles lose strength, the entire weight of the body shifts directly onto the knee joint, forcing it to work overtime and speeding up wear and tear. And what is even more concerning is that if this weakness is ignored for just a few months, the risk of tripping, misstepping, or losing balance increases dramatically. I've had many patients tell me, "Doctor, I think I'm hurting because I'm getting old." But when I examine them, I often find something completely different. They're not weak because of age. They're weak because the muscles that protect the knee have been neglected for far too long. The good news is this: the situation can be reversed. Your body still has the ability to recover whether you're 60, 70, or even 80 as long as you activate the right muscles in the right way. And in today's video, I'm going to help you understand why this knee pain that seems harmless is actually your body's early warning signal, and how you can stop its progression with one simple daily exercise, the same exercise that has helped many of my patients see noticeable improvement in just a few weeks. In my many years of working with adults over 60, I've heard countless stories that I will never forget. There was a 8-year-old gentleman who sat down in front of me and said, "Doctor, I just want to stand up from a chair without having to push with my hands anymore." There was a 4-year-old woman who spoke so softly, as if she didn't want anyone else to hear. "I just want to walk around my house without pain. I don't want to bother my children." And there was an 82-year-old man who gave me a sad smile and whispered, "I'm afraid of the day when I won't be able to walk on my own anymore." These sentences may sound simple, but for those living with knee pain, they carry a deep emotional weight. In their eyes, I see more than discomfort. I see the fear of losing independence, something we all hope to hold on to for as long as possible. What touches me most are the small, everyday things that knee pain steals from them. The fear of stepping down a small curb, the hesitation to take a walk in the park, the loss of confidence when standing in the kitchen, or having to hold onto the wall every morning just to steady themselves. These small changes make many people believe they are getting old, but the truth is different. It's not that they have grown weaker because of time, it's that their bodies haven't been activated properly for far too long. Years of only light walking, months without strengthening the hips, thighs, and glutes, slowly erode the stability around the knees. But the most important thing I want you to know is this: the body can repair itself. I have seen so many patients from age 60 all the way to 85 regain confidence in their steps simply by performing a few correct movements each day. I am sharing these stories because you are not alone. There are millions of people in America experiencing the same struggles, and just like them, you can become strong again. And that is exactly why I'm here today, to walk with you on this journey to regain your independence, beginning with understanding what your knee pain is truly telling you. Before we continue, I'd like to ask you something small, yet very important for our shared health journey. How old are you, and which state are you watching from? I read every single comment because I want to truly understand this community, to know what challenges you're facing, what support you need, and how I can help you even more in the next sessions. And if this is your first time here, I'd love for you to tap the red subscribe button below, along with the little bell icon, so you'll be notified whenever I release a new video. Not for the numbers, but so we don't lose touch, so I can continue guiding you through simple, safe, and incredibly effective exercises that strengthen your knees, back, hips, and your whole body day by day. Now, before we begin the most important exercise in today's video, I want you to truly understand what is happening inside your knees. This is essential because when you understand the cause, you'll know exactly what to do to fix it, and your results will come much faster. After the age of 60, the body goes through a process called age-related muscle loss. But this decline does not happen evenly throughout the body. What's most surprising is that the muscles most critical for knee stability, the quadriceps, the hip muscles, and the glutes, are the ones that weaken the fastest. When these muscles lose strength, the knees are forced to work twice as hard to support the body. And when a joint has to do the job that the muscles are supposed to do, it quickly becomes overloaded, worn down, and painful. This is why so many people say, "Doctor, I only stood up for a moment and my knees started hurting." But here's something even more important. Walking, the activity most older adults rely on, is not enough to activate these key muscle groups. Walking uses only a small portion of the quadriceps and barely engages the hips and glutes, which are the body's natural shock absorbers for the knees. So even if you walk every single day, your knee pain may still worsen, because weak muscles remain weak without targeted strengthening. A 2023 study from the Mayo Clinic followed hundreds of adults over 60 and found that adding just one quadriceps strengthening exercise per day reduced knee pain by an average of 52% in 4 weeks and improved balance by up to 38%. The science is clear. When the muscles become strong again, the knee is unloaded, pressure decreases, and the joint heals more effectively. In other words, knee pain is not the end of the story. It's your body gently reminding you that it needs the right kind of support. And that support begins with the exercise I'm about to guide you through next. Now that you understand why knee pain happens and what is truly causing it, we're going to move into the most important exercise of today, an exercise I like to call the knee saver because it has helped thousands of adults over 60 stand up more easily, walk more steadily, and reduce knee pain within just a few weeks. This exercise is simple, requires no equipment, and activates the exact muscles that have been asleep for years, the muscles your knees have been working over time to compensate for. Let's begin by preparing a sturdy chair. Sit down with your feet hip-width apart and your heels planted firmly on the floor. From here, lean your body slightly forward, as if preparing to stand, and then slowly push yourself up, using the strength of your legs without using your hands to assist. As you reach a full standing position, gently exhale and keep your back upright. Then, slowly lower yourself back down, controlling the entire movement. Do not drop into the chair. As you sit, take a deep breath in. This is the rhythm we want: slow, steady, controlled. Be sure not to let your knees collapse inward as you rise or sit. Keep them pointing straight ahead, just like your toes guiding the direction. And if you feel slight fatigue or warmth in your thighs and hips, that is an excellent sign. It means your hips, quads, and glutes are waking back up. For the first week, perform 8 to 10 repetitions each day or every other day. In the second week, increase to 10 to 12 repetitions. In the third week, move to 12 to 15 repetitions. And once you feel comfortable, you can hold a small weight about 1 to 2 pounds to challenge the muscles a little more. This is how we rebuild your knees' natural shock absorbers. When performed consistently, most older adults tell me that they stand up more easily, walk with greater stability, feel less afraid of misstepping, and most importantly, wake up with far less stiffness in the morning. That's why this exercise is considered a foundational movement for protecting the knees and restoring independence after age 60. Before we continue, I want to remind you of something very important regarding safety during this exercise. If at any point you feel a sharp pain, stabbing pain, or a sensation as if something is pinching or catching inside your knee, please stop immediately. That is your body's way of saying it needs rest, or that your form needs to be adjusted. However, if what you feel is mild muscle fatigue, gentle warmth in the thighs, or a light stretch in the hips, that is completely normal and actually a very good sign. It means the key muscle groups are waking up again after being underused for a long time. Remember, our goal is consistency, not doing as much as possible in one session. Slow, controlled, and correct movements are always better than pushing yourself too hard. If you've had knee surgery, a joint replacement, or are currently taking pain medication, move at a slower pace and keep a sturdy chair behind you for extra support. Your body is incredibly smart, listen to it. And with gentle persistence, the results will come faster than you might expect. Now, before we finish today's session, I'd like you to take a few quiet seconds to simply feel your body. Stand still or sit comfortably, relax your shoulders, take a gentle breath in, and slowly breathe out. In this moment, notice how your legs feel. You might sense a little warmth in your thighs, a bit of lightness around your knees, or a steadier, deeper rhythm in your breathing compared to when you first started. All of these small signals carry a very big message. Your body is responding to your effort. The movements you just performed are not just an exercise. They are the very first building blocks of a stronger foundation, a foundation that helps you stand more steadily, walk with more confidence, and most importantly, maintain your independence in daily life. Every time you stand up without needing your hands, every step you take without the same pain, every morning you wake up with less stiffness, is proof that your body is healing. I want you to feel a sense of pride in this moment. Because the most important thing is not how many repetitions you completed, it's that you chose to begin. You took time for yourself, you trusted your body, and you allowed yourself to step into a recovery journey, a journey that will bring better days, one practice at a time. Hold on to this feeling. Let it stay with you. Because this quiet sense of progress is the very motivation that will help you continue growing stronger in the sessions ahead. Before we close today's session, I want to offer you my sincere gratitude. Thank you for giving yourself this time, for patiently listening to your body, and for putting care and effort into every single movement. Every minute you invested today doesn't just make your knees stronger. It opens the door to a future with more confidence and more independence, something all of us value deeply as we enter our 60 seconds, 70 seconds, and 80 seconds. If today's session brought you even a little relief, a little hope, or simply the feeling of "I can do this," then I'm truly honored to continue this journey with you. And if you'd like to receive more gentle, safe, and senior-friendly exercises, I'd love for you to click the red subscribe button below and turn on the little bell so you never miss a new video. Not for the numbers, but so we can keep meeting here, keep moving together, and keep building strength and independence day by day. Thank you for spending this time with me today. I wish you a light, energetic, and joyful day, and I look forward to seeing you in our next session.